How does conception and pregnancy occur? Olena Berezovska. In the life of almost every woman at a certain period, the question of conceiving children arises to create a full-fledged healthy family, regardless of whether she has had interrupted pregnancies before or will have more in the future. Most families plan for 1 to 3 children, although some welcome more children. This means that in the life of almost every woman, there are periods when she looks forward to a positive conclusion. Pregnant. As soon as the period of this uncontrollable desire to have a child begins, artificial problems are created that accumulate and provoke the emergence of new endless problems, right up to childbirth, and then passed on to the newborn child. Many women, while waiting for a child to appear in their lives, begin to intensely listen to everything that is happening in their bodies, even before the next menstruation is due. Let us consider some important factors that influence conception and the successful implantation of the fertilized egg in the uterus, and discuss the question of how great a woman's chance of normal conception is, and how justified are the fears that overcome those who want to become pregnant as quickly as possible, as well as issues of diagnosing early pregnancy. When does pregnancy start? Let us become acquainted with how the female body functions in order to understand when a woman can get pregnant and when not. Almost all modern doctors count the beginning of pregnancy from the first day of last menstruation. This means that any woman who is active and has regular, every 2-3 days, sexual activity can be pregnant for 4 to 4.5 weeks at the time of her next expected period. When a woman or doctor talks about pregnancy at 2 to 3 weeks, this may mean that a fertilized egg appeared 2 to 3 weeks ago. That is, fertilization has occurred, conception. But again, there may not yet be a delay in menstruation, or it is only a few days. However, such a calculation of gestational age is very inaccurate, and this method should not be used because any mistake entails an incorrect calculation of the expected date of birth. Therefore, obstetricians and gynecologists around the world agreed many years ago that the beginning of pregnancy was the first day of the last menstruation. That is, the moment when a new female reproductive cell begins to mature and will then be fertilized. This calculation of pregnancy duration was carried out in women whose menstrual cycles were regular and lasted 28-30 days. Those who have a cycle of more than 30 days, and a cycle of up to 40 days is usually the norm, resort to ultrasound to determine the exact onset of pregnancy, or apply an amendment by subtracting 1 or 2 weeks from the date of the last menstruation, depending on the length of the cycle. Now, let us look at the important factors that influence conception and the successful attachment of the fertilized egg to the uterus, and at the same time discuss the question of what the chance of a healthy woman is to conceive a child, and how justified are the fears that overcome those who dream of getting pregnant quickly. What are the roles of men and women from the perspective of nature? No matter how much we all hide behind our high position on the tree of evolution, no matter how proud we are of the ability to speak, create, and think, in the eyes of nature, we are all males and females created to continue humans through sexual intercourse. Therefore, all of us, except for rare individuals, are endowed with organs of reproduction, that is, organs responsible for reproduction of their own kind. This means that each of us has enormous potential to realize the plans of nature unless we ourselves dampen or eliminate this potential. The reproduction process includes the following steps: production of normal female germ cells, eggs, production of a sufficient number of full-fledged male germ cells, spermatozoa, the movement of germ cells through the fallopian tubes. Therefore, a normal number and normal sperm motility are very important for conception, where the egg is fertilized. Movement of the embryo into the uterine cavity through the fallopian tube. Finally, It's normal implementation into the uterine wall, implantation, with further normal fetal development. A few words about sperm. Sperm maturation occurs in the testicles of men. However, a number of other genital organs, glands, are also involved in the formation of high-quality, healthy sperm, a liquid with certain properties containing spermatozoa. Sperm mature in approximately 74 days, but do not think that this is a spasmodic process. It occurs constantly and continuously from puberty to advanced age. However, over the years, the number of unhealthy male reproductive cells has increased, which negatively affects their mobility and ability to fertilize an egg. Every day, a healthy man produces up to 100 million spermatozoa every second, up to 1,500. Because the fetus is gestated in a woman's uterus, the man acts as a sperm donor. Sperm quality determines its fertilizing ability. If there are any abnormalities in the sperm, the process of conception may be disrupted, or the conceived offspring may have a low survival rate, leading to pregnancy loss. How many spermatozoa are needed for successful conception? In the ejaculate of a healthy man, and therefore a healthy sperm, only 10% of the spermatozoa are activated, which allows them to acquire fertilizing qualities, and the remaining sperm do not have fertilizing activity. Does this mean that more sperms are better? Excess sperm is harmful to the female reproductive system and can interfere with conception and implantation of fertilized eggs. When artificial insemination is performed and sperm is introduced into the uterine cavity, the amount of sperm must be strictly controlled to prevent damage to the egg. This is because spermatozoa die inside the female genital organs, vagina, cervix, uterine cavity, fallopian tubes, in large numbers. In this case, enzymes that destroy the egg wall are released. On the one hand, such destruction is necessary for the entry of the spermatozoid. However, too many dead spermatozoa lead to a serious violation of the integrity of the female reproductive cell and defective conception. Such aggressiveness of sperm is often observed with polyspermy, the presence of a lot of sperm in the ejaculate, or frequent sexual intercourse with ejaculation in the vagina. A few words about female reproductive cells. Germ cell maturation occurs differently in women. The fact is that all the germ cells of each woman appear at the very beginning of the intrauterine development of the female fetus. With age, the number of these cells decreases, and their quality deteriorates. In other words, the initial supply of eggs is gradually depleted rather than being replenished daily. Every day, from the prenatal period to old age, women lose and never regain their reproductive cells. Eggs are not renewed, therefore the ovaries should be protected like the apple of your eye from the moment the girl is born and throughout her life, especially if the girl, woman, plans to become a mother. Key periods of egg death. There are 3 key periods in a woman's life when eggs die at a particular intensity. The first peak occurs at the 20th week of intrauterine development, when out of a total reserve of 7-10 million gametes, primary germ cells, only approximately 2 million germ cells remain in the female fetus. During this period, having gone through the stage of simple division, mitosis, the gametes form follicles, vesicles. However, many follicles are not destined to grow to large sizes and reproduce mature eggs. The second period of rapid egg death is associated with birth. A newborn girl has approximately 1-2 million eggs, oocytes. At that time, the content of female sex hormones, estrogens, in the child's body increases, since the girl receives most of them from her mother before the birth. Many follicles begin to grow. However, because the level of estrogen quickly decreases after delivery, placental hormones disintegrate and are excreted from the body, and the girl herself has a very low level of estrogen, they regress without reaching full development. Most follicles die via apoptosis, programmed cell death. Often, a newborn girl experiences mild vaginal bleeding because the inner lining of the uterus, endometrium, also peels off owing to a sharp decrease in estrogen levels. The third period of death of many eggs occurred during the first years of puberty. By the time of her first menstruation, the girl had approximately 400,000 oocytes. Estrogen levels rise again, leading to intensive growth of many follicles. However, most stopped growing again and regressed. At the end of puberty, each girl's ovary contains only 25,000 oocytes, which continue to die in the future but at a slow pace. Surgical interventions on the ovaries and pelvic organs, as well as the use of several medications and radiation in the treatment of malignant diseases, can lead to the death of eggs. It is believed that a woman with a regular menstrual cycle produces approximately 400 mature oocytes during her life. Some sources estimate it to be 300, 500. This does not mean that she can become pregnant 400 times, because not all eggs are healthy. It is also necessary to exclude periods during which a woman does not have sexual intercourse with a man. Typically, after 37-38 years of age, most female eggs begin to die at an accelerated rate. When their number reaches 1,000, menopause occurs, which is observed closer to 50 years of age. Chronological and biological age. There are concepts of chronological and biological ages. Chronological age is a person's age in years, months, and days since birth. Biological age, in medical terms, is determined by the levels of hormones and other substances associated with the aging process. From a reproductive point of view, this age depends on the ovarian reserve of follicles and the ability to reproduce offspring. Eggs not only mature and leave the ovary for fertilization, which is called ovulation, but they also age in the same manner as humans. It is good if the aging process of eggs occurs after ovulation. However, in some women, they age before ovulation. Such germ cells are not capable of fertilization, or if fertilized, their division will be of poor quality, ultimately leading to poor implantation and loss of pregnancy. Modern medicine makes it possible to determine the causes of infertility in most couples. However, over the years, the quality of germ cells noticeably deteriorates. The ovaries begin to age first, and this occurs at a very early chronological age, after 30 years. No matter how hard we try to outwit nature, she has given us a very narrow window for obtaining healthy offspring with a minimum number of complications, for both mother and child, from 21 to 25 years. According to the recommendations of professional societies of obstetricians and gynecologists, the optimal age for conceiving children is 20-30 years. Of course, women become pregnant both at an earlier age and at a later age and give birth to completely healthy children. How is an egg fertilized? Now, let us turn to the question of egg maturation to understand when a woman can become pregnant and when not. The monthly cycle, that is, the period from the first day of menstruation, always from the first, to the first day of the next menstruation, is divided into two phases, delimited by the day of egg maturation and the days of menstruation. Estrogen, first phase, proliferation phase. Progesterone, luteal, second phase, secretion phase, depending on the production of certain hormones, such as estrogen and progesterone. We usually count the first day of the cycle from the beginning of menstrual bleeding and not blood smearing. The first phase lasts from 10 to several weeks. The second phase is always more stable and usually lasts 14-15 days. Stability is because the egg has already matured, and if it has not been fertilized and pregnancy has not occurred, the female body quickly prepares for a new cycle, freeing the uterus from the old endometrium through menstruation. With a poor quality corpus luteum arising from a mature follicle, a lack of progesterone may be observed, which most often manifests itself in short cycles, up to 20 days. Long cycles, on the contrary, may be accompanied by a lack of ovulation. Therefore, there is no corpus luteum, which means there is no second phase. You must understand that the second phase of the cycle depended entirely on the quality of the first phase. The first phase can be very short or, conversely, long. Therefore, the duration of the menstrual cycle normally ranges from 14 to 40 days, although most often it is 21 to 35 days. Classic cycles neck to neck, when a woman menstruates every 28 days, do not happen in real life often, since too many factors influence the duration of the cycle. The norm is a 7-day fluctuation in the cycle in both directions. In other words, the period may start a week earlier or later than the previous cycle. Therefore, there is no need to worry and run to the doctor if menstruation occurs with a delay of 2 or 3 days, or, on the contrary, begins a little earlier. A few words about egg maturation. Folliculogenesis is the process of maturation of female germ cell oocytes. Follicles have their own gradations or maturities. Primary follicles, vesicles, are called primordial follicles, PFs. The activation of primordial follicles is a complex but controlled process that begins with the sexual development of the girl in adolescence with the rapid growth of vesicles. This process is irreversible. If the follicle does not become dominant, its death occurs through atresia. That is, the size of the follicle decreases and the oocyte dies. More than 99% of all follicles received at birth die of atresia. Only in the last 2 weeks of the oocyte's life does its final maturation occur, which ends with ovulation and is regulated by pituitary hormones and gonadotropins. However, the mechanism underlying the regulation of primordial follicle growth remains unknown. Typically, approximately 70 primary follicles begin to grow, approximately 60 follicles reach the secondary state, class 1, and approximately 50 become early antral follicles, class 2, which occurs over the next 25 days. Approximately 20 follicles reach the antral level, class 3, within 20 days, and only about 10 of them are sensitive to FSH, follicle-stimulating hormone, and begin to grow. Therefore, within 14 days, the growth of one of them will end in ovulation when the follicle bursts. All the other follicles die. This process takes more than 6 months. Therefore, in the first phase, the egg matures, which is in the ovary in a special vesicle, follicle. Typically, several follicles begin to grow in both ovaries, but after the 7th, 8th day of the cycle, only 1, less often 2, follicle continues to grow, only to burst between the 13th and 16th days, on average on the 14th day. Sometimes, women mistakenly believe that the ovaries work alternately. 2 ovaries are always working, and the growth of follicles with the onset of menstruation occurs simultaneously. Only approximately on the 7th day of the cycle, usually the 3rd day after the end of menstruation, does a follicle begin to dominate in one of the ovaries, the growth of which culminates in ovulation. Meanwhile, the ovaries continue to work because they need to get rid of follicles that have begun to grow but have not become dominant. Ovulation is more often observed in the right ovary, in more than 60% of cycles, and is associated with better blood supply. There is no order in the maturation of follicles. Therefore, ovulation can be observed in the same ovary for several cycles in a row, which is the norm. Couples planning a pregnancy should understand that there are limits to the time they can conceive of a child. Considering that eggs age from the moment of ovulation and some begin to age even before it, the window for successful conception is very narrow. During ovulation, a mature egg, a female reproductive cell ready for fertilization, leaves the ovary and ends up in the abdominal cavity, but it is immediately sucked in by the fallopian tube, one end of which has a funnel with special cilia. The egg is capable of fertilization within 12 to 24 H, and then it simply dies and dissolves if conception does not occur. The concept of late ovulation is inaccurate and not correct enough. With long cycles, ovulation does not occur in the middle of the cycle, but is closer to its end, which is the physiological norm. Where the baby is conceived. Once in the ampullary, widest part of the fallopian tube, the female germ cell meets male germ cells, spermatozoa, which begin to attack it intensely. They die, but not in vain. Their contents liquefy the thick wall of the ovum, and finally, one lucky manages to get inside the egg, which practically absorbs it. Often, the spermatozoid loses its tail. Thus, the statement that one spermatozoid is sufficient to conceive a child is not true. Under natural conditions, millions of active motile spermatozoa play a very important role in conception, but only one of them fertilizes the egg directly. Modern in vitro fertilization, IVF, technology makes it possible to obtain an embryo by injecting one healthy male cell into an egg. The fertilized egg then travels down the fallopian tube to the uterus and undergoes several divisions, which is how the embryo is formed. The traveling process takes 4-6 days. Approximately 30 hours after fertilization of the egg by sperm, the first division, clearance, occurs, which largely determines the course of the entire pregnancy. Scientists engaged in reproductive technologies that allow artificial creation of embryos have found that if the very first division occurs poorly and unevenly, the gestational egg may also be of poor quality, leading to its poor implantation, which means that such a pregnancy is very likely to end in a natural termination. It is not possible to artificially influence the division of fertilized eggs. The fertilized egg is divided into numerous smaller nucleated cells. These cleavage stage cells are called blastomeres, and the embryo in this state is called a zygote. First, division is not accompanied by the growth of these cells. That is, the original size of the embryo is preserved. However, when the number of cells reached 16, their differentiation and size increases. At this stage of division, the embryo, which is now called the morula, enters the uterine cavity. Division continues, and as soon as fluid appears inside the morula, the embryo is called a blastocyst. The blastocyst contains primitive villi, the chorion, hence the name of the hormone chorionic gonadotropin, with the help of which the implantation process begins in the uterus. Preparing the uterus to receive the fertilized egg. What happens in a woman's body as a fertilized egg travels down the fallopian tube? The uterus prepares to receive gestational eggs. The uterine cavity is covered by a special tissue, the endometrium, which can change under the influence of hormones produced by the ovaries. In the first phase of the menstrual cycle, the endometrium, the inner mucous membrane of the uterus, grows. Its cells divide and grow, and in the second half of the cycle, after ovulation, they are saturated with nutrients. Let me remind you that the second phase is also called the secretion phase, whereas the first phase is called the proliferation phase. The thickness of the endometrium plays a role in the attachment of the gestational egg to the uterine wall. Many women do ultrasound checkups to measure the thickness of the endometrium, but much more important is the good quality of the endometrium, which is achieved in the second phase of the cycle due to the increase in progesterone levels. In most women of reproductive age, the endometrium has an average thickness of 5 to 8 millimeters during ovulation. During these 2 to 3 days of being in a suspended state in the uterine cavity, the fertilized egg secretes special substances that suppress the mother's defenses because it is a foreign body for her body. Progesterone, produced by the corpus luteum of the ovary, in turn suppresses the contractility of the uterine muscles, that is, calms its response to the egg and relaxes the uterus, allowing it to implant. The increase in progesterone levels also leads to the appearance of special formations in the endometrium pinopods that resemble tentacles, fingers. They appear between the 19th and 21st days of the menstrual cycle and exist for only 2 to 3 days, with a 28-day cycle. Their appearance leads to the fact that the uterus decreases in size, as if shrinking due to these protrusions inward, and the cavity itself also decreases in size, bringing the uterine walls closer to the egg floating in it, thereby reducing the distance between the uterus and the egg for its successful attachment. While the egg is not attached to the uterus, the intrauterine fluid released by endometrial cells under the influence of high levels of progesterone becomes a source of nourishment. Thus, the process of introduction attachment of the gestational sac to one of the uterine walls begins. Attachment of the embryo. The process of attaching a gestational egg to the inner wall of the uterus is called implantation. Successful implantation determines the development of pregnancy and its outcomes. Implantation success depends primarily on 3 important factors: embryo quality, 90% success rate; morphologic quality of the uterine endometrium, i.e., the condition of the cells of the uterine lining; biochemical quality of the endometrium, or presence of essential hormones and other substances in the uterine tissue. Many other factors may also affect the implantation process. Attachment of the embryo is a rather long process with strict stages. The first few days after implantation is referred to as the implantation window. Outside this window, attachment of fertilized eggs is impossible. It begins on the 6th to 7th day after conception, 20th to 21st day of the menstrual cycle, or 3 weeks of pregnancy. If under the influence of external and internal factors, this period is shortened, or the staging of changes in the endometrium is disturbed, implantation may also be disturbed, resulting in miscarriage. Embryo implantation occurs in 3 stages: attachment, sticking or adhesion, to the endometrium; drilling, penetration of the epithelium; embedding, invasion, into the uterine wall to be fed through maternal blood vessels. The first stage of attachment begins on the 21st, 22nd day of the menstrual cycle and is not accompanied by bleeding. The second stage of drilling can theoretically be accompanied by bleeding, but practically there are no data on bleeding on the 23rd, 25th day of the menstrual cycle. Bloody discharge on the 27th, 31st day of the cycle is noted most often, and it is possible that this is implantation bleeding, since during this period, the uterine vessels are partially damaged in the process of becoming relationship with the gestational egg. Most often, implantation takes place on the posterior wall of the uterus because this wall is thicker, has more vessels, and is located deep in the pelvis. Nature tries to protect the future offspring as much as possible. In other cases, the attachment of the egg may take place on the anterior wall and sometimes on the sides of the uterus. But this does not mean that the pregnancy in such cases will not progress. The paradox of implantation. Implantation is called the double paradox of nature biological and immunological. In the process of implantation, there is a certain struggle between the mother and the future child, to accept or not to accept. That is the question. A child and mother are two completely different biological objects with an individual set of chromosomes. Many women cannot accept the concept of a foreign body egg. It is important to know about it without emphasizing the fact of foreignness. However, understanding the relationship between the two human bodies will help avoid false conclusions about the harmful effects of pregnancy on the female body, and vice versa. The immunological paradox is that two opposite processes occur in the mother's body: stimulation and suppression of defenses. On the one hand, the embryo releases substances that begin to signal its presence, and the mother's body activates a protective reaction, trying to neutralize the presence of foreign proteins. However, other substances in the egg suppress the mother's immunological response through a very complex mechanism and allow implantation to be successfully completed. The role of inflammation in implantation. Another peculiarity of the implantation process is the occurrence of an inflammatory reaction at the attachment site of the embryo. A fertilized fetal egg is representative of a new life, and for a woman, therefore, a foreign body. When doctors perform organ transplantations, they realize that it is necessary to suppress the body's defenses. In such cases, signs of low inflammation in the area of transplantation indicate that the organ or biological tissue, e.g., skin, engrafted well. The area of inflammation is characterized by improved blood supply, hence the redness, delivery and production of many useful substances, as well as the creation of a fence, a kind of barrier delimiting the area of inflammation from the rest of the tissues. The same phenomenon occurs in the place of attachment of the egg. Inflammation starts, which improves the process of implantation and simultaneously limits the influence of the female body on the body of the future child. During this period, a woman takes drugs that suppress the inflammatory response, aspirin, ibuprofen, and other nonsteroidal anti-inflammatory drugs, and the implantation process may be disrupted. Implantation and checkups. In modern medicine, the onset of implantation actually means that the pregnancy is already 3 weeks along. The main process of egg attachment takes 2 weeks, and early pregnancy losses are observed precisely as a result of poor implantation. In such cases, pregnancy is most often terminated at 5 to 6 weeks, that is, on the 7th to 14th day of menstrual delay. However, until a delay occurs, the woman usually does not even suspect that she is pregnant and continues to take medications, drink alcohol, and smoke. If you are planning a pregnancy, it is very important to be careful during the second half of your menstrual cycle when undergoing several diagnostic tests and taking medications and alcohol. If treatment cannot be postponed because it is necessary, unprotected intercourse should be avoided during the middle of the menstrual cycle. Often, women are overly concerned about the welfare of the unborn child and are willing to have an abortion only because they had to take antibiotics, hormones, and other medications before menstruation and did not know they were already pregnant at that time. Remember, normal progress of pregnancy is the best indicator of the normal development of the baby. One termination of pregnancy can result in infertility for the rest of one's life, and there are many such cases. The first 2 weeks of embryo attachment are very important for the prognosis of pregnancy, but in general, attachment continues until 20 weeks, until the baby's place, placenta, is fully formed and fully functional. Therefore, if we consider the whole process of conception and implantation, at the beginning of your next period, your pregnancy lasts at least 4 to 4.5 weeks, even though you were not pregnant for the first 2 weeks.